Human brain surgery, also known as neurosurgery, is a complex medical procedure performed to treat various neurological conditions, such as tumors, epilepsy, aneurysms, and traumatic brain injuries. One common approach to brain surgery is through a procedure called a craniotomy. Let me explain how this works. 1. Preoperative evaluation. Before the surgery, the patient undergoes a thorough evaluation, including medical history, physical examination, imaging scans, like MRI, CT scans, and possibly functional brain mapping to identify critical functional areas of the brain. 2. Anesthesia. On the day of surgery, the patient is administered general anesthesia, which renders them unconscious and pain-free during the procedure. 3. Positioning. The patient's head is positioned securely in a special head holder to ensure stability during the surgery. 4. Skin incision. A skilled neurosurgeon makes an incision in the scalp, usually behind the hairline, following the natural contours of the skull. The size and shape of the incision depend on the specific condition being treated. 5. Skull flap. After exposing the underlying skull, the surgeon uses a high-speed drill and other specialized tools to carefully create a bone flap. This bone flap is temporarily removed to access the brain underneath. The size and location of the bone flap depend on the area of the brain being operated on. 6. Brain exposure. With the skull flap removed, the brain's protective covering, called the dura mater, is gently opened. This exposes the brain tissue that requires surgical intervention. 7. Surgical procedure. The surgeon performs the necessary procedure on the brain tissue. This might involve removing a tumor, repairing damaged blood vessels, treating an aneurysm, or addressing other neurological issues. 8. Intraoperative monitoring. During the surgery, various monitoring techniques might be used to ensure the safety of the patient. These can include intraoperative imaging, such as MRI or CT scans, and functional brain mapping to identify important functional areas of the brain. 9. Closure. Once the surgical procedure is completed, the surgeon carefully closes the dura mater using sutures. The bone flap is then repositioned and secured in place using plates, screws, or other materials. The scalp is sutured or stapled closed. 10. Recovery and postoperative care. After the surgery, the patient is moved to the recovery area and closely monitored. Recovery time can vary depending on the complexity of the surgery. Some patients might require a stay in the intensive care unit, ICU, before being transferred to a regular hospital room. Pain management, wound care, and neurological monitoring are essential during this phase. 11. Follow-up. After being discharged from the hospital, the patient will need to follow up with the neurosurgeon for regular checkups and possibly rehabilitation, if needed. Long-term recovery and rehabilitation might be necessary, especially if the surgery impacted functional areas of the brain. It's important to note that brain surgery is a highly specialized field, and the procedures can vary based on the specific condition being treated and advancements in medical technology. Neurosurgeons undergo extensive training to ensure the safety and success of these complex procedures.